It's me at the pod. For my pharmacology midterm, I have Dopaminergics. I already did the pre-simulation, so I'm going to start the simulation now. Okay. Alright, so right now it's Thursday at 1900. The scenario is the patient has medications due soon. Student actions: review the patient's MAR and prepare to administer the medication. So I'm on her chart and I'm going up to the MAR right now. Okay, so I'm in the MAR. Alright, I'm looking at the medication she has right now. She only has one that's regularly scheduled, and that's the Cinemet, which is the dopaminergic, which is what I'm going to be administering, due at 2100. And that's a 125 milligram tablet. Alright, so student actions: I have a level 1 nursing student who is precepting me, asking me the questions. I'm going to say them out loud like she's asking me, and then I'm going to go ahead and answer them. Why specifically is this client receiving this medication? The client has Parkinson's disease, so the Cinemet, which is the dopaminergic, is going to, well, along with what action does it have on the body, it acts on the dopamine receptors. So it not only activates them and helps release the dopamine, it also prevents it from breaking down, and it does various actions to allow it to go ahead and act on the body to help relieve the side effects of Parkinson's, which include like the tremors and the muscle rigidity. When should you question administering this medication? I would question it if there was any kind of cardiovascular history. When I looked on the chart, I saw that the patient's father had died of cardiac disease, but she herself didn't have any kind of cardiac history, so I'm not concerned with that just yet. Does the medication have a therapeutic serum level? No, it does not. And what vital signs must be monitored? Because one of the side effects with this medication is orthostatic hypotension, I'm going to be vigilant about monitoring her blood pressure and her pulse, especially when she's changing positions, like from laying down to sitting up to standing up. What physiological parameters should be monitored when the medication is being administered? Besides the blood pressure and the pulse, there's some chance of cardiovascular complications, including things like the palpitations and tachycardia, which is why you would question giving it to someone who has cardiovascular issues. So I would want to monitor their EKG, just make sure they aren't displaying any kinds of signs like that. The medication is primarily used to improve the symptoms of Parkinson's disease, like the muscle rigidity, tremors, grimacing, anything like that. So I would obviously want to be on the lookout for that and make sure that I'm not seeing that. If I did, then I would have to change the dosage of the medication. And it also has some effect sometimes on promoting psychosis. So if that were to happen, I would want to make sure to call the physician and get a second-generation antipsychotic prescribed for the patient. So I would do neurological checks with that and just kind of monitor any change in their behavior. What interventions must be taught to ensure the medication is administered safely in the hospital setting? When you initially start taking the medication, you want to take it in small doses with food, but over time you want to avoid taking it with food. You would want it to be on an empty stomach, and you would want to avoid high-protein snacks or meals because that can lessen the therapeutic effect of the medication. So I would advise the patient to try to break up their protein intake throughout the day. What interventions must be taught for taking the medication safely at home? Again, the protein intake slowly throughout the day, not having like a big meal that has a lot of protein in it. They would also need to avoid foods that are, or vitamins that have vitamin B6 in them, which would be things like green vegetables, wheat germ, liver, legumes, any kind of whole grains or cereals, and bananas as well, because that can also affect the therapeutic effect of the medications. Along with that, because of the orthostatic hypotension, I would advise them to change their position slowly, just in case for some reason their blood pressure dropped too low and they fell or anything like that. And also, the medication has a side effect of discoloring sweat or urine, but that's just a harmless side effect. I would tell them not to worry about that. What are the side effects and potential adverse effects? Again, the discoloration of the sweat and urine, the change in psychosis, which is something that I would be wanting to monitor while giving the medication, nausea, vomiting, drowsiness, any kind of cardiovascular effects that would be affected by the beta-1 stimulation, which would be like tachycardia, palpitations, things like that, and an irregular heartbeat. If they had some kind of undiagnosed skin lesion, it could activate a malignant melanoma, so I would want to make sure to keep an eye out on that. And it can also cause more dyskinesia, which would be the side effects that you would normally see in patients with Parkinson's disease, like tremors, head bobs, tics, and things like that. And how do I know the medication is effective? By a decrease in the effects from the Parkinson's disease, like I would see less tics, less grimacing, less tremors. They wouldn't be experiencing muscle rigidity, and they would be able to carry on their activities of daily living. Okay. The patient complains that her urine has been dark since her physician switched her to Cinemet and is worried. All right. Provide a response to the client based on her concern. Enter the client's room and administer the client's medication safely, and document the teaching provided to the client. Okay, so her urine is dark. Okay. I'm going to take this over to the patient's room. Knock, knock, knock. Miss Ledoux? Hi, my name's Samantha. I'm the nurse that's going to be taking care of you right now with your medications. I understand that you have some concerns with some of the side effects that you're experiencing from your Cinemet. And I'm going to go ahead and get ready to give this to you and address any concerns that you have. Can you just verify your name and date of birth for me really quick? Alright, great. Do you have an allergy band? No. Do you have any allergies that I should be aware of that might not be documented? Okay. And it says on your chart you don't have any. And yep, that's your name, and you are who you say you are. Alright, so right now I have your Cinemet due, which is for your Parkinson's. One of the side effects of the Cinemet is actually the darkening of the urine, which you are experiencing right now. It's just a harmless effect. It won't do anything to harm you or hurt you in any way. It's just kind of an annoyance. But it's not anything that's serious enough for the physician to cancel out the benefit of the medication for you. So let's see, you have a 100 milligram, 25 milligram tablet. Okay, I'm going to pull your curtain here just to provide you with some privacy. Okay, let's see. Alright, I have your armband here. the end here for your number. My medication is not coming up. I have tried the different armbands for both of them. To do. Okay, these numbers are not matching up on my computer, and I have tried them several times. I don't want to proceed without a barcode scanner, but I don't see how I'm supposed to do it without this, considering I'm supposed to administer medication for this assignment. So I'm going to do that, but not intentionally. And it says it's 2100, so I'm going to administer medication as directed. Okay? Alright, so Miss LeDuc, besides the dark urine that you're experiencing as a side effect from your medication, I just want to let you be aware of some other ones that you might experience. If you have any kind of dyskinesia, which just means more of the side effects that you experience with Parkinson's, like the tremors, rigidity, grimacing, head bobs, and tics, just let me know and we'll decrease the dosage for you. I want you to go ahead and press your call light if you need to get up or need any kind of assistance in any way, because this can affect something called orthostatic hypotension, which just means that your blood pressure drops a little bit more than we're comfortable with whenever you're changing position, like going from lying to sitting to standing up. So I just want to avoid any kind of accidents or any falls with that. If you're experiencing any kinds of signs of like hallucinations or nightmares, let me know and I'll get a hold of the physician for you right away to get some medication to help you fix that. And also, I just want to make sure that you take your food take your medication without eating any food, and try to avoid high protein foods and snacks like meats and cheeses and things like that, because it can lessen the effect of your medicine, and also avoid foods that have vitamin B6 or any kinds of supplements. And you can find vitamin B6 in things like bananas, whole grains, green vegetables, anything like that. Okay? Okay. I have the levodopa cinnamon, 100 milligrams, 25 milligrams, 1 tablet, and that matches what I have on the MAR. Got that ready. I'm just going to go ahead and wash my hands. And on some gloves. I would do this before I put the medication in the cup. Okay, and I just want to make sure that you haven't eaten anything, that you're taking this on an empty stomach, and you haven't had too much protein or any kind of cheese sticks like we talked about. Okay? See, I'm going to go ahead and, well, this bed's funny, but I would elevate the head of the bed into a sitting position so that they could go ahead and drink while they take their pill medication. So here's the pill and the cup of water. I'm going to watch them while they take their medication, make sure that she's actually swallowed it and not just going to throw it away or anything like that. Okay. Alright, wash my gloves, wash my hands. Make sure I lower the bed back down. Alright. Is there anything else I can do for you while I'm in here? Did you have any more questions regarding your medication that I could help maybe clear you up on? Okay. Let me see. Your call light's within reach, and please just let me know if you need anything further, okay? I'm going to go ahead and leave you to rest now. Make sure I take my monitor on wheels out of the patient's room. Okay, and my medication has been administered. Okay, that phase is completed. Okay. Student actions. I have a level 1 nursing student who I'm precepting who's asking me some things. Out loud, verbally answer the question as if the student was with you. 1, were there any pertinent pieces of information you reviewed before administering the client medication? What were they? Yeah, I looked at the patient's history and physical, her vital signs. She didn't have any kinds of labs that she had to have done or anything like that, but I looked over her chart and along with her MAR to see if there were any kind of pieces of information that I needed to know. Like if she had a history of cardiovascular issues, I would be concerned with administering this medication to her. Just things like that. Like she had a blood pressure that was a little high, so I would want to monitor that along with the orthostatic hypotension. That would make me want to monitor the blood pressure as well. But other than that, there wasn't anything that made me really question giving this. Did this information affect your decision to administer the medication? If yes, explain how. It did because, like I said, there was nothing that made me really question it. She didn't have any kind of cardiovascular issues or history in the past that made me not want to give this medication to her. There wasn't anything that made me want to call the physician to make sure it was safe to give her the medication, so I did it as ordered. Did this information affect how you administered the medication? If yes, explain how. It did because I was able to give it as ordered with the 125 milligram tablet and just give it to her at the time that it was needed. And that's it. Thank you.